Fibromyalgia, fact or fiction? Fibro is defined by the Mayo Clinic as a disorder characterized by widespread musculoskeletal pain accompanied by fatigue, sleep, memory, and mood issues. So basically, fibro is a disease that involves a variety of other symptoms followed with chronic pain. There's been much controversy over fibromyalgia, and as a result, the patient care can be hindered. Despite the opinions of many doctors and scientists, there have been many scientific advances within the fibro community.
Fibromyalgia is a chronic disorder that affects at least 5 million Americans, mostly women. It's characterized by non-restorative sleep and muscle aches and stiffness that may last all day, pain in all 4 quadrants of the body, and the presence of specific tender points. While fibromyalgia pain can vary in intensity, sufferers often describe it as a deep, persistent ache or a stabbing or shooting muscular pain. Other common symptoms include incapacitating fatigue, insomnia, joint pain, leg cramps, headaches, and concentration and memory problems known as fibro fog. Because there is no lab test or X-ray to confirm a diagnosis of fibromyalgia, some patients were once led to believe this pain was all in their heads. Today, many researchers think the brain and spinal cord process pain messages incorrectly, causing fibromyalgia patients to feel pain more intensely. One of the unique aspects of fibromyalgia is the presence of tender points in specific locations on the body. When these points are pressed, people with fibromyalgia feel pain, while people without the syndrome only feel pressure. To be diagnosed with fibromyalgia, a patient must be sensitive in at least 11 of the 18 possible tender points and experience widespread pain in all 4 quadrants of the body.
People become more sensitive to pain because of the way the brain processes signals. Those problems can arise from surgery, trauma, stress, infection, or with no reason at all. The central nervous system, the brain and the spinal cord, is forced to work harder to try to overpower these processing issues. Women are more likely to develop fibromyalgia because men have more testosterone in their systems. Along with pain, people experience headaches, joint pain, irritable bowel syndrome, anxiety, depression, and memory issues. These memory issues are called fibro fog by doctors. There is no known cure for fibromyalgia, although medicine helps with the symptoms along with relaxation, exercise, and stress reducers. There have been tests like the white blood cell test because people with fibromyalgia have a weaker immune system and therefore have less white blood cells, but people call that science junk because of a lack of evidence. Fibromyalgia is controversial because it's considered a spectrum disorder, a disorder that cannot be diagnosed with a simple yes or no. Some doctors refuse to diagnose fibromyalgia because it cannot be quantified, and it's mainly based on patient reports. The research lacks a clear-cut line between people that qualify to be diagnosed with fibromyalgia and people that don't, because there's such a wide range of symptoms within it. The University of Colorado has recently discovered 3 brain signals patterns in the brain that can identify someone with fibromyalgia with 93% accuracy. Those signals are related to hypersensitivity of the brain, which is with pain the most common fibromyalgia symptom. This new information allows people to study fibromyalgia as a central nervous system disease. Recently identified as a neurological disorder, there are many people that view fibromyalgia as an autoimmune disorder or a disease that forms from other chronic pain conditions. Frank Rice and a team at Albany Medical College has discovered excess nerve fibers lining blood vessels of the skin of people with fibromyalgia. Although this has been discovered, there is doubt that fibro is a real neurological disorder because of a lack of evidence. My mother has had fibromyalgia for about 5 years now. Members of my own family tell my mother that her symptoms are all in her head and that her disease isn't real. After living with my mother and doing my research, I am able to conclude that fibromyalgia is a real disease, a life-changing disease.